So today, since we're talking about Twitter specifically, we wanted to kick things off by showcasing all of the work that happens across all social media channels within Atrium Health. So it's really a humongous channel and honestly a great opportunity for us as we see more and more people getting news from their phones and online compared to the 5 o'clock news. So I want to do a quick poll. How many of you actually sit down and watch the news at night? Oh, wow, okay, higher than I thought. So maybe like 10 or 11, and the local news are like CNN or national? Both, okay, well that's good to hear. And how many of you check your phones on a regular basis for news? Okay, great. So you can see you're getting your news from both sources, so it's just a great way to maximize it. So what we pulled together here are a few of what we call our biggest hits. So these are some of the stories and content that we've put out on our social media channels that have performed incredibly well. So probably our biggest hit to date, unless Florence takes over this week, we shall see, is the story of baby Elea. So baby Elea was the smallest baby ever born at Levine Children's, and actually the second smallest in the entire world. So when this story broke, it was huge. We first shared it on our Facebook page and then Twitter, and then little by little, media started picking it up, and it ended up being on Good Morning America, The Today Show, Yahoo News, all kinds of news online. It was a huge story. So that was kind of our first big break, if you will, on social, and that one story enabled us to quadruple our social media reach. We just got thousands of more followers from that one post.
And then you all, of course, recognize this story. This is the press conference that we pulled together within an hour and a half back in June after 2 high-profile suicides. So you can see how well this ended up doing on our Facebook Live channel. And it's just a testament to how great you guys pulled this content together and this panel of experts. So anytime we can do that, there is something timely happening that our behavioral health team should respond to, this is something we're going to tag you for. And since you did such a great job, this time around, we're going to, of course, continue to expect that. So thank you guys so much.
Here's an example of another great story that we worked with our Neurosciences Institute. So this was a patient called Dean. The best way to summarize the story is Dean was riding his bike early one morning. He got hit by a car, was paralyzed, rushed to CMC, told he had a 2% chance of ever walking again. Well, not only did Dean walk again, but he challenged his neurosurgeon to run a marathon with him. And by the way, they also ran that race with the driver who hit him. Great story. Did tremendous. We had the Today Show, Ellen, and we were actually just following this story from the beginning. So we just, every week we had to push. This was right when Jerica started, actually. So I'm like, here's your assignment, Jerica. So we did check-ins with them leading up to the big race, which was kind of like the finale of the story, but we did all kinds of check-ins along the race anytime they would practice running, or we did little interviews with them, so we got a lot of bang for our buck on this story. It was actually a series as opposed to just one post.
And it's a great example of how not only clinical expertise should be highlighted in those really severe, highly clinical cases should be highlighted, but also characters. This is a great story of good character. He immediately forgave the driver for what he did to him, asked the neurosurgeon and that driver to run with him in a marathon. Those are the types of stories I'm looking for, and I know I've told many of you in this room that sometimes it's just a good character or a good relationship that a doctor and a patient have that can make a story. So that's a good example of that.
And this one over here, this is the Danielle Geither story, as we call it. So interestingly enough, when this story was first pitched to media, she had a very complex heart condition. And media was like, they weren't into it. And we're like, what? You guys are crazy. This is an amazing story. We're going to tell it anyways. And we posted this clip of Danielle who met her baby the first time. It was kind of a conjunction of she had her heart surgery and then she gave birth, like simultaneously. It was very crazy. And so as soon as that clip went out, then everybody went bananas for it. And the phones were ringing off the hook. Everybody wanted that story. So it was just really interesting to see. At first they were like, not into it. But when we were able to share content, they loved it. This is another example of posts that do really well. So this is actually just like a little spotlight on one of our cancer docs. This is Dr. Bailey Dorton. She works over with the supportive oncology department. And every now and then, we just like to profile some of them and just talk about what they do. So she's actually a breast cancer survivor herself, turned nutritionist, and she helps her patients, and she always says, hey, if I can do it, you can do it too. So we like to share neat stories like that, and they always do really, really well. And this was just a great story about one of our nurses who came up with a heartbeat in a bottle. So it's for babies who've passed away, but they were able to track their heartbeat right before, and then they give it to the mom to wear around the neck. So this is another story that we shared first on social, and then it went viral. Here's some Twitter posts that have done really well this past year. Our Kids Eat Free program. This one is with Dr. Antoinette Tan. This was actually at the ASCO conference in Chicago. So conferences are an amazing opportunity for us because during the conference, they always have the hashtag for the conference, for those of you who've been. Everyone's tweeting about it. Everyone wants to be like, hey, I'm at this conference, and here's what I'm learning, and here's what I'm sharing. It's just an awesome way to engage with other people in your network, so not just within Atrium Health, but across the board.
Which is exactly what I was doing at NatCon, running around taking photos and all of that good stuff. And NatCon was retweeting everything I sent, so it's really good.
Yeah, and we just did a quick 30-second video with Dr. Tan just talking about one of the groundbreaking studies. And it wasn't her study, but she was just like, here's my opinion on this study. And people found it really interesting. And as soon as we posted it, we had 2 calls from local media. And they're like, hey, can we do a Skype interview with Dr. Tan? And so right there in the lobby of the conference, we did some Skype interviews. So it was pretty cool. And then the reason we included this post with Greg Olson is some of you might know him. He's a tight end with the Panthers. So he's what we call a influencer, kind of like we were joking about Victor, but not really joking, because you kind of are. But collaborating with people like Greg Olson, who have tremendous reach on social media, is just the ultimate platform. Because now you have all of these thousands of people, not just in Charlotte, but everywhere else, who are like, oh, I've never heard of Levine Children's. Who are they? And why is Greg Olson collaborating with them? I'm going to follow them too. And yes, exactly. So it's just collaborating with people who have those big numbers. And when they are able to include our name in their content, we always see those numbers go up. So it's just a great way for us to always be thinking about, hey, who are some influential patients we might have had? Or who are some families who really resonate with the work we're doing? Can we collaborate with them? Can we give them some content to share on our behalf? So just thinking through those strategies as well. LinkedIn, how many of you knew that we had LinkedIn, a presence on LinkedIn? Okay, great. That's awesome. Just make sure you're following Atrium Health now, since our name switched over, and it won't do it automatically, so you'll have to go back in. So I just wanted to throw that PSA out there. But this is a great way to put out content. I think, Victor, we shared one of your articles on LinkedIn, didn't we? Mental health first aid. Yep. So anytime that one of you is like, hey, I would really like to share my thoughts on X, Y, and Z, let us know. We can help you write it. We can pitch it to the editors at LinkedIn, and it's just a great way to get this information out to a network of your peers. This is more LinkedIn, just showing awards, for example, when we got top 50 places to work, and of course, the news about how we raised our minimum wage did really well. Instagram, who's following us on Instagram? Oh my. Tonight, our Instagram officially switches over to Atrium Health. Yay. It's been a process, so just keep that in mind. But what we love on Instagram, which is very photo heavy, so LinkedIn was more copy heavy, Instagram is more about the photos. So of course, this picture of the superheroes cleaning the windows of the Children's Hospital, that's a no-brainer. People, every year, and we do it every year, and every year it just gets bigger and bigger and bigger.
And sweet baby.
And sweet babies. Who doesn't love sweet babies? YouTube, we also have a YouTube channel. So all the behavioral health videos that Jerica has worked on live on YouTube, FYI. So in case you have presentations and you're like, I need to connect to purpose, what do? You can go on YouTube. Just a little tip. But we have lots of great content on here, tons of videos that we work on, just showcasing the best of the best when it comes to all of our service lines. Why we're here today is because we really want to encourage all of you representing behavioral health to get front and center and to share all of the great content that's coming out of this team. Because we can't do it alone, and Atrium Health is just one account, but think about if we multiplied all that's happening here with all of your channels and your networks, that's going to be tremendous.
And we're focusing on Twitter today because it is so easy. You can do it from your phone. It's really quick. If you don't feel like actually typing your own tweet, just go in and retweet someone else, and that does a lot. When I was talking about engagements earlier, those are engagements. When you retweet, when you like a tweet, and when you share it or anything like that. So that's why we really want you guys to get involved on Twitter, just because it is so simple. And Claire already introduced herself, but most of you, if not all of you, but Bill and I had not met. But so my name is Jerica Swartz. I'm on Claire's team. She is my supervisor. I support behavioral health and also the Neurosciences Institute from a PR standpoint. So I'm the one reaching out to you all the time with requests and asking you to share things, and we're going to show you how easy it is today. All right, this kind of breaks down the terminology if you're not aware of some of these things. So Twitter, it's just a very popular public instant messaging system that lets a person send out a brief message with info. It can be fun. It can be whatever you really want it to be. Now, what's called a tweet is the actual post that you're putting on Twitter. Where on Facebook, it's called a post. On Twitter, it's called a tweet. I know it's hard to keep up with some of the lingo, but it is kind of simple once you get used to it. And then, of course, a retweet would be you tweeting someone else's tweet. So there's a button you click, and it's just retweet, and it happens instantly. Like I said, super easy from your phone, so that's why Twitter is fantastic. Replies and direct messages. So say you want to reply to someone's tweet. Instead of retweeting it, you just want to say, oh, wow, what a great story, and just engage with them. That is counted into the engagement numbers. Also, you might see a tweet, but you want to direct message them instead of your reply being public, because replies to tweets are public, as far as if your account is public, of course, which we'll talk about later. And also, whoever you follow and follows you can see that. So maybe you just want to say, like, someone posts a story and you're saying, I'm thinking about that family, about that story that you posted. Let me know if I can do anything to help or anything like that, if you want it to be private. That's really easy too. You might see sometimes that there is the @ sign in front of someone's handle. Now, your handle is what your username is. So, for instance, mine is Jerica Ashley. So if you're trying to tweet at me, it's @ Jerica Ashley. Super easy to look up if you're following me already. And then hashtags are really easy to search. So that's why anytime we do a campaign or we're tweeting about a topic or anything like that, we try to signify or identify a hashtag that everyone can use, because then you can just search that hashtag on Twitter, find all the content, and retweet away. Go for it. So it's really easy to do. And then, like I said, your Twitter handle is what your name is. So it needs to be something that's easy. It doesn't need to have a lot of symbols or numbers in it. Like, it wouldn't want to be Jerica Ashley Swartz 1 2 3 4 5 6 7 8 9 hashtag exclamation point. It's way too difficult. So try to make it as easy as you can. There are a lot of users on Twitter. I mean, millions of them. So sometimes you might want to do your name, but it's a really popular or not rare name, so you'll have to come up with something a little more clever. But including your name in that handle is really important.
So this is important too, because we have found that once the easy thing is out of the way, okay, I have my username and I have my email set up, but then we realize, we look and we're like, wait, there's no photo there. So when people go to look for you, they don't know if it's you, because all they see is like a blank circle. Nobody wants to be a blank circle. You're all a lovely looking group of people, so we want to make sure we have your face front and center. So we certainly have that. And if you are coming to us and say, we don't have a headshot, Jerica brought her camera today, so no excuses. We will take your photo, and that way you have something so people know who you are.
This mentions the bio. This needs to be about you. So since all of you, we're wanting you to post about behavioral health and what you do. It can also be fun stuff, though. We encourage you to, add Atrium Health in your bio. So that would be @Carolinas, because that's what our Twitter handle is. Until tonight, that is correct. So in my bio, it's @Carolinas PR specialist. And then I mentioned like some kind of quote. And then I also mentioned, and I wanted to throw this out here as well, I learned this in my TV news days, add a clause that says opinions are my own. Now, the reason I say this is because if you're mentioning Atrium Health, you of course are then representing Atrium Health. But if you follow Victor on Twitter, you can see that it's perfectly fine to post about your personal life, just as long as it's appropriate. Just as long as, you know, you're still representing Atrium Health well. He posts personal stuff all the time, and it's fantastic. So just keep that in mind. Opinions are your own kind of protects you. So that's just something really easy to add to your bio.
Yeah, we like to say, think of the grandmother rule. So pretend your grandmother's watching over and reading all of your tweets and content on social. Would you want her to see what you're putting out there? So just keep that in mind.
Mine too, but from above. The navigation bar, so there's a home tab where you can access your Twitter stream. So it's pretty easy. Once you just start clicking around, I won't go through exactly what everything is. Start clicking around and discovering how easy it is. A lot of times I'll click on, like I have 13,000 tweets or something like that, but that's over several years and also back when I was a reporter too. But you can click in there and see like what you've tweeted about a lot lately, or you know what, I haven't tweeted about this, so maybe I should go search a hashtag that's mental health matters or something like that. Sometimes I'll notice it's a certain awareness month, so I'll search an awareness month. So there's a search bar. There's a connect tab where you can find replies from people, what I was talking about earlier. So you'll get a little notification, like on Facebook, it'll have like 16 in a little red box because you have 16 notifications. Same thing happens on Twitter. So you can see how people are engaging with you and what you've tweeted. And if you notice that a certain topic or story that you've tweeted has gotten a lot of engagement, tweet more. It's not Facebook where you're going to overwhelm the audience. Facebook, you wouldn't want to post multiple in a row about the same thing. Twitter is live. That's why we a lot of times say that I'm going to live tweet an event or a conference. It just is forever continuing. So you can never really tweet too much. Unless, of course, you're tweeting like 5 tweets in a row about your socks, right, Victor? That's right. Yeah. Now, the Me tab is just where you can look at your profile and see how it looks. This up here is considered the same thing on Facebook where it's a cover photo. For me, I just have like a pretty photo of a sunflower. And then my profile photo, which is right here, it's circular. It is circular just like our logo is. That's not circular just because it's the logo. And I just have like a professional headshot there, but it doesn't have to be a professional headshot. You can have something more casual. I have, once again, my camera today, and we can go outside and take a photo. It's whatever you want to do. So you can check out your profile, see how it looks. This is where your bio is. So this is where I'm asking for you guys to put in here that you are with Atrium Health if you intend to use your account, sometimes for professional reasons. I use my account for personal and professional reasons, which is perfectly fine. So does Victor. So it's up to you.
So how do you incorporate Atrium Health into your bio?
You would put,
Right. You could say like administrator at Atrium Health.
Mm-hmm. And
like
it would be
avid exerciser, whatever. Just like fun little things about you.
right, and it would be at Carolinas using that at sign. So you could put a behavioral health administrator at, and then you'd use the at sign Carolinas.
But tonight it'll be at Atrium.
Atrium Health or at Atrium?
At Atrium Health.
Atrium Health. Mm-hmm. Oh, compose a tweet. So this is really simple. I won't spend too much time on this. But in the upper left corner of twitter.com and also on your app, you'll see a box where you can click compose a tweet, and this is where you type it. Tweets used to be 140 characters, but now they're 280. Not that I encourage you to use the full 280 because that could be too much copy, but sometimes it's helpful if you're including a hyperlink and also a video or a photo. So just know that you have a lot more characters to type your tweet now, double as many as before. So this is really simple. There's a little icon right here where it's a photo like a mountainscape, and that's where you can attach a photo. GIFs are always fun. And then these are both ones that you'll never use. This is graphing, and then this would be a location. A location doesn't really post, I don't think, as well on Twitter as Facebook. Facebook, it goes at the top of your post, and it's really simple. Twitter, it kind of gets lost in your tweets. So what's this? Reply and retweet and favorite. I kind of went over this before. Reply would be when you respond to someone's tweet, it is public. Retweet is when you just click a button and it automatically shows up on your feed. Favorite is when you click the heart. And all of that plays into your engagement score. Tweet chat, this isn't something I've personally used myself. Claire, is there anything you want to touch on with this?
I would just say that a tweet chat is just a good opportunity if you all, so for example, the suicide event Friday. So let's say you weren't all physically meeting in person, but you're like, you know what, this is important, we need to talk about it. You could all just get on your mobile devices and just start sharing content and information and then include that hashtag, and then essentially it turns into a tweet chat. And what we would do on the back end is reach out to our networks on social and say, hey everyone, on Friday from 10 to 11, we have a panel of experts who are all talking about anything related to suicide. We encourage you to follow that conversation on Twitter. So then they're like, oh, that's pretty cool. They go on their phone, they type in the hashtag, and they can see what everyone is saying. So it's a way to think of it almost like a virtual panel. That's an easy way to describe it.
The line between personal and professional can be blurry, like I said, like Claire said. Just imagine your grandmother's reading it and whether you think it's appropriate. Like I said before too, you can choose to use your Twitter account just professionally or professionally and personally. It's really, truly up to you. I do both, and it's not as hard as you think it is. Be mindful of the world's longer memory and protect your privacy. So just remember what you're putting out there. For instance, maybe you have a family member that's battling with addiction. You wouldn't want to put their name out there or any identifiers or anything like that. It's public. And protect Atrium Health's good reputation. We touched on that. Adding that clause in your bio, opinions are my own, really does go a long way. And use your best judgment. Remember, there's always consequences to what you publish, so just keep that in mind. Speak in general terms. So when I talk with you guys about media pitches or interviews and I prep you before, I always say keep it at a 5th or 6th grade reading level. Same thing on Twitter. And there is an Atrium Health HR policy and social media guidelines that you can easily access. There's some available on People Connect. And then I can send this, when I send my recap of this morning's meeting, I can attach this PowerPoint and a few of these helpful links, the Twitter basics, the guidebook, how to use Twitter. Hopefully we've touched on that enough. If you're like me though, you're visual and you want to look at it and go over a few things with me on your phone, that's perfectly fine. We're available until 10:30. We're sticking around. So when I start a campaign, at the very beginning of the campaign, I try to go ahead and identify a hashtag then with our social media manager. For instance, with the addiction campaign I'm currently working on with Lisa McCanna, we identified Atrium Health Addiction. Now that seems long, but the reason we did that is because it hasn't been used before. So anytime we used that hashtag and we searched it, it was definitely our content. Where I did think of There Is Hope or, Addiction There Is Hope or something like that, but those have been used in the past. And we also have a social media feed on our landing page for that campaign. And so if I were to use a hashtag that had been used by others for different reasons, their content was going to show up on our feed, and that's not what we want. We want our content. Another way to think about using hashtags, that's just in reference to a campaign, would be to find one that is being used a lot. So it'd be the opposite, where if you're just tweeting something like that, I would say making up a hashtag is perfectly fine.
And I will say too, sometimes hashtags can be a little bit tongue-in-cheek. So it doesn't necessarily need to be an official hashtag. So for example, Dr. Castro, if you were to do a tweet today, the Twitter 101, you could do hashtag I don't know what I'm doing, hashtag help please. So those are all kind of funny. They're not like super official, but people get it.
When you use these, the whole point behind tagging people in tweets and all of this and hashtags is to get engagements. That's why. So if someone sees a hashtag that they really like, they're more likely to engage with you and retweet that. And if you send a tweet to someone, they're going to respond as long as they're on Twitter.
Social media, we always say the whole point of it is to be social, right? You don't want to just have it, and we call it like a lurker. Like there's some people who have Twitter and they just like look, but they don't do anything. That's because you're kind of lurking. It always works better if you engage, you hit likes, you reshare, you comment with other people. That's the point of it, and that's what's really going to help.
Not every tweet is going to include tagging someone and also using a hashtag, so just keep that in mind. Not every single tweet will. Anytime I'm talking about the work I'm doing, I do tag @Carolinas because then she'll see it, and if she likes it, our social media manager, she'll retweet it.
Yeah. And
Starting tomorrow, and it'll switch over automatically.
Yeah, it'll switch. This sounds like a lot of information. It is, especially for those who are newbies. I will say the best way, as with everything, is download the app. Just kind of mess around with it. I promise in like 10, 15 minutes, you'll be like, oh, this is so simple.
And I do encourage everyone, once you do, if you don't have Twitter and you create a profile, go in there and think of a bunch of things that would contain content that you would want to engage with. So Miami Dolphins, Buffalo Bills, anything like that. Just go in there and start following a bunch of people because that's the only way you're going to get a feed. If you start a profile and you don't follow anyone, you don't have a feed. So just keep that in mind.
So I know a lot of you too might be thinking now, oh my gosh, this sounds great, but it's a little overwhelming. I have so many other things to do. I cannot add one more thing to my plate. We hear you, we get it. So what we've been doing over the past couple of months is working on a pilot. So we're just calling it the Social Media Brand Ambassador Pilot. And what this is an email that will be sent directly into your inbox about twice a month with content that's already created, photos, copy, hashtags, handles in there. And all you have to do is click the button and it'll go directly into your own personal Twitter account. What we wanted to do is just arm you all with something that's ready to go. So this is for somebody who's like, I'm overwhelmed, I'm stressed, I get this is valuable, but I cannot devote any more time to it. This is like the easiest thing. If you want to take it up a notch, you can personalize things just a little bit. You could engage with your fellow coworkers or other people. So there are ways to elevate it, but this at the very basic is you're doing something, which is better than nothing. Now, I will say this is a pilot program, meaning if it is not successful, my boss will chop my head, take away the money, and say we're not doing it anymore. And I'm very sad to say that the metrics for behavioral health across all the service lines are the lowest, and I do not want that. I will not be responsible for that. I will not have Jerica responsible for that. So we need to bump it up. So I'm challenging all of you today, please, please, please participate in this. Share the email with everyone in the team, and we're going to walk you through. So this is the one that went out last month, that there were no tweets or shares. Very upsetting. So we'll scroll through it a little bit. So once you have your account set up, all you have to do, and you can see this is the copy that's already populated, tell patients that if they're helping a loved one, we can help. Boom, share it on Twitter. And that's it. That's all you have to do. Why taking a vacation is so important for our mental health. Look. And you have LinkedIn too. We're focusing mainly on Twitter because we really want to get our numbers up so we can continue the pilot.
It's also the easiest once again.
Yes, super easy. And you'll see it's going to be a mix of our own content within the service line as well as what's trending. So we partner with an agency that looks into that. So they say, okay, Claire and Jerica, here's what's trending this month, so we feel it's important to include some information about this. So the email that you're all going to get tomorrow, guess what's on there? Hurricane Florence. How to talk to people through the emotional distress. So we have a list, I think, is it 10 on the email, the brand ambassadors? I believe so. But we obviously want to grow that number. So what Jerica will do, it's going to be twice a month. Now we're trying to, again, it's a pilot. It's a little clunky. We're working through it, so bear with us. But if you want to forward it to your colleagues and to people on your team, that'll help too. Or you can, of course, just send us a name. We'll add it to the master list. But if you don't remember to, at the very least, just forward it along, and that would be super helpful. There's a lot of programs in place that are designed to help with that exactly. There's pros and cons, right, as with everything. On the pro, yes, you only have to think about, let's say, once a week, you generate all your content, put it all in there, and boom, then it's taken care of. But on the con, it's not real time. So if you're at a conference, you're like, oh my gosh, this is amazing, I want to share it with my followers. You still have to pull out your phone and do it, because guess what? You didn't know about it 3 days ago. And it is, I don't know the cost for Hootsuite. I'd have to look into it. And there's a little bit of a learning curve. It's not like it's super duper easy. Like, it's possible to learn, but
For someone like yourself, I want you to get comfortable on Twitter first before you start doing all that crazy stuff and creating followers and all of that stuff. Start by retweeting and following people, and then you'll get a sense of what it's like on Twitter. It's really easy, it's casual.
well, and that's why we recommend Twitter too, because it doesn't have to be grammatically beautiful. It doesn't have to be perfectly polished. It's supposed to be organic, raw, misspellings, like it's okay. It's not like a LinkedIn, which, yeah, you better bet your grammar is on point and you've had 10 people edit it and review it. This is very different.
On Twitter, people use abbreviations in order to fit more content into a tweet, so it's totally fine too. You'll notice that as well.
Don't focus so much on like, oh my gosh, I need more followers. I would say, especially in the professional setting, it's more important about following people in your networks, in your industry, people within Atrium Health. That's more important than a bunch of random robots or like people who you've never met nor interacted with in your life.
Also, National Council for Behavioral Health, you guys know the organizations that we work with a lot and care about and have the same messages as us. So just think through that when you're going in and trying to create a profile and followers. Be thoughtful in that and follow people. Yes, you can.
And what we can help with as well, especially for those of you starting out, if you were like, I don't even know where to begin, who do I follow, who within our system is important that I should be following, we have that and we can create those lists, so we're happy to help with that. And we want to be a resource for you all because we know how important it is. Anytime that any of you tweet our content or important news, it's a boost for Atrium Health, for behavioral health. It makes a difference, but it only makes a difference if everyone's doing it.
And there are multiple apps for Twitter. I personally don't even use the traditional Twitter app. I use one that's called Echo Phone.
And I think it kind of goes back to like, all right, knowing that Gene Woods could go on Twitter and see what you're posting, like just be thoughtful, right? Like just think about it. And maybe, you know, if you are that individual who is so passionate about politics and you really love engaging with people, then yeah, maybe have a separate one. Like go for it. Yeah, if you're that passionate, sure, go for it.
There truly are pros and cons because if patients aren't engaging with you a lot on social media, then you're not having to deal with it. I know that sounds horrible, but you know what I mean by that. And then also the con is, of course, we always want to engage with our patients. So I think our purposes for training you all and wanting you to use these platforms is not really the patient engagement, because I do understand that in the behavioral health space, that's not really something that would happen. So our purpose is to elevate your clinical expertise and share all this wonderful content that we have. I know a lot of you thought highly of the ECT video. I've tweeted that. You could retweet it.
Thanks, everyone.
Was this helpful? Helpful?
We look forward to seeing boosted numbers.